Welcome to Constant Variables, a podcast where we take a non-technical look at building and growing digital products. I'm Michael Roth. Let's get nerdy.
This episode is sponsored by the Mahonis Group, your partner for expert mobile and web software development. We've built mobile apps and admin tools that have touched nearly every industry, but being that we're located in the heart of Medical Alley, the companies we've worked with most have been in the health sector. So we collected the medtech work we've done and put it all in one place. If you want to check it out, visit jmg.mn/medtech. You can also find that link in this episode's show notes.
Hey Frank, welcome to the show.
Hey, Michael, thanks for having me on. It's a pleasure to be here.
Yeah, well, it's my pleasure. I'm very excited for our conversation today and to get to know a little bit more about you and Medical Alley Starts in general.
Oh, yeah, no, I'm excited for it. And I got to say with your intro, I think we'll be able to get very nerdy on this one. We're in good company.
Perfect. One thing that surprised me a little bit in my research about your background when we were leading up to this, I envisioned you as the VP of intelligence with Medical Alley, that you would have been in some sort of corporate role higher up at multiple organizations previously and then transferred over to this position. I was surprised to see that you had started out with Medical Alley in an entry-level role back in what looks like 2005, if that's accurate.
Oh, yeah.
I'd love to hear a little bit about what led up to that role and then maybe what has kind of thrown what seems like a passion for you to stay with the company for over 14, maybe 15 years.
Yeah, I'm coming up on my 18th anniversary once the calendar crosses this year. Wow. I've had the proverbial from like the mailroom and front desk moving on up. Back into 2004, I was working at the state capitol, and I got assigned to a committee in the House that was working on some biotech policy, funding Mayo Clinic and the University of Minnesota to do advanced genomics research. And one of the arguments was that it would help create more biotech-related jobs in the state. I found that interesting, wanted to know more about it, and stumbled into a job, honestly, at Medical Alley. Like literally on the same day I got the job at the Medical Alley Association, I also got a job at Home Depot across the street from the Medical Alley Association office. Medical Alley had health insurance, so I took that job.
Sure. That's amazing. So it was kind of a one or the other there, and you were still offered a full-time role at Medical Alley.
Yeah, exactly, right? Like, but for the benefits, who knows what I'd be doing today. And then along the way, I got extremely lucky early on that I had bosses who, were committed to this community. They wanted this place to be the best place on earth for healthcare and health innovation. And they were committed to developing young people into leaders. So as an entry-level employee, literally working the front desk, receiving people, responding to emails, I would get tasked with, hey, go meet this CEO and learn what they're doing and then come back and let's figure out how we can help them. Yeah. I just got to do that over and over and over again, meeting with different CEOs, and I really enjoyed it.
That's an awesome look at the internal life for a Medical Alley employee to see it so supportive and growth focused.
I'd say, almost 20 years now of each successive CEO we've had, and now that I'm in a leadership role, I try to do the same thing. We bring really smart young people in and give them an opportunity to go interact with some of the smartest people on earth, some of the most passionate people on earth, and learn from them. And to their credit, these CEOs, these executives of startups, of big companies, of hospitals, they are willing to spend their very precious time helping us learn and grow so that we can then turn around and be of service to them and to their community.
I love that focus and willingness towards building a collaborative community so that everyone can benefit from it, because it really is amazing in some businesses that get more relational focused, how planting those early seeds and putting value in younger employees and willing to commit to them or in other businesses and business to business transactions can just lead to so many fruitful relationships down the road that you wouldn't get in another scenario or ecosystem.
100%.
So to finish laying the groundwork, Medical Alley is kind of viewed as the Minnesota Silicon Valley for med tech and medical networking in general. Would you be able to help explain what the Medical Alley Association is and the role it plays? And I know it does go greater than just the Minnesota region in the connections you guys have.
Yeah. So I would describe Medical Alley as a network and a catalyst for healthcare transformation. Minnesota in particular has one of the largest and most concentrated healthcare and health innovation industries in the world. Medical device leaders, healthcare leaders, payer leaders, digital health, biotech and diagnostic, 14,000 different healthcare companies across the state. Our job is to make sure that those companies and those people are around tomorrow and a generation from now, saving lives around the world and making lives better. So if you go back in time, 1984, Earl Bakken, the founder of Medtronic, along with a few others, started Medical Alley in the wake of the computing industry in the state collapsing. It said if that can happen to computing, it could happen to healthcare. So our job for almost 40 years now has been to make sure we are the disruptors and not the disrupted.
I love to see the preventative work too by the team when they are in a position of success to look towards prolonging and stabilizing the industry rather than just focusing on their own business and profits and progress.
Yeah, we are, I would say, incredibly fortunate that we have a business community here. And this is generally true for Minnesota, but I think it's exceptionally true in healthcare and health innovation. It's an industry, there are lots of competitors, but it is also a community that truly cares about the ultimate goal, helping people live better lives. So we see it all the time, and one of our jobs is to maintain this culture where competitors routinely get together and help each other to make sure that patients do better. There are companies that will tell a doc, hey, our competitor's product would be better for this patient. You should use that. Or during the pandemic, we saw the health systems, device companies, drug companies come together to get the right resources to the right place. In other communities, that took a lot more work than it took here. And it's because there's been this generational effort to maintain that culture of collaboration.
So an interesting thing I've started to hear around events I've gone to as I've gone to more networking focused events in my position is that especially in Minnesota, there really is that collaborative community focus in business that sometimes lacks in other areas of the country. Have you had experience outside of Minnesota and found that to be lacking there and that it's something that's especially prevalent here that you guys are able to spread?
100%. I mean, I got an email from a former member last week. They're now in California, and their email was, I had to leave Minnesota to realize what I had. And the sender went on to talk about how much easier it was here to find help, to find suppliers, to find partners, to tap into the network, because there was that community, which they don't have in California. And we see this all the time with our international work. We'll host delegations from around the world, and they go to Boston, they go to Silicon Valley, they come here. And almost every time they end up telling us, gosh, when we get to Minnesota, every meeting we have, by the end of the meeting, the person is like, okay, let me call this other person who you should meet because they can help you solve that problem. Or let me introduce you to this investor that I've been working with that might be relevant for your company. That like extra step of where the company doesn't have to help them, but they do because they know if they do that work, that's going to benefit a patient someday. And it's going to put karma into the community that's going to come back and help them with their own work.
That's such an awesome point to see shared in another industry. I'm new to tech in my position here with the Mahonis group, and I'm about 4 or 5 months in now. So it's been really eye-opening to see the shift from my previous industries into a collaborative industry where it's more so seeing endless resource and just trying to get everyone to bring the most value to their product that they can.
Yeah.
And even in companies that you would sometimes expect competition, it's so fun in Minnesota that we've seen both, it sounds like, where companies can help each other out and really try to boost the other, even if there's no direct gain for them in that moment.
Right on. It makes me glad to hear you say that about the broader tech industry. Um, we're in a tech industry in healthcare, med tech, biotech. They're all tech industries, but I sometimes feel very disconnected from the rest of the tech industry because healthcare can be so specific. So it makes me very happy to see you're seeing that in the broader tech industry as well.
Absolutely. So another place where I think our organizations somewhat overlap is focusing on startups and entrepreneurs. Would you be able to talk about how your position has led you to the head of Medical Alley Starts and what Medical Alley Starts means to you?
Yeah. So Medical Alley Starts is an initiative we had created about 2 years ago now to better support our startup community. We've always had startup members. About half our members are startups, and in many cases, like real startups, pre-revenue, early stage. We're working with two companies right now that aren't even incorporated yet. They're that early.
Oh, wow.
It is incredibly important to me and to the organization. Healthcare is an industry that truly depends on new innovations, better surgical tools, better drugs, better software systems. There is so much improvement yet to be made. And then the nature of the business is one where startups are necessary to keep the innovation engine going for the large companies. There's certain kinds of R&D that the bigger companies are really good at, and then there are things that startups are better at. So if you have both, you're going to have a more vibrant ecosystem. You're going to help more people live better lives. So we made a decision a couple of years ago to really double down on that startup community and try and provide a set of services, provide a set of supports that we didn't see being provided elsewhere, with the goal of growing up this ecosystem even faster than it is already.
So it's fun to see that a company as large as Medtronic would see the value in getting something going to support it, and that you guys have continued that and focused on startups the way you do. What type of resources can Medical Alley provide to those startups to continue their contributions to the larger companies?
Oh, yeah. No, great question. And I'll say on the large company piece, they all get how important it is to have a vibrant startup ecosystem. Medtronic, United, 3M, Boston Scientific, Mayo, all of them, because they know the startups are going to help them find disruptive innovations, help more patients. So they've been great partners in this. What we provide for the startups, I like to say stupidly simple. We focus on capital, customers, and talent. Right? Those are the three most common challenges we would hear identified by the startups. And what we observed was there were lots of different efforts that would support a small number of companies in depth, think an incubator or an accelerator. What we didn't see was a service bureau, an entity that could serve a high volume of companies with the day-to-day challenges that come up in being an entrepreneur or having a startup. And so our job is not helping you figure out your strategy or negotiate your deal. It's today you have a problem that you need to build your first board. What do you do? Okay, we'll help you find people who have been there, done that before, that can give you perspective and advice and give you a gut check. Now you're raising capital. Okay, you found some angels, you found some VCs. Let's help you identify additional ones, make connections, get a perspective on the market, know what sorts of red flags different investors are looking for so that you have a higher probability in that pitch. Then later on in your company, you're growing, you need to get out and tell your story. Let's help you with PR. Let's help you figure out marketing. Let's make sure more people know what you're doing. And then maybe you get to the point that you want to have an exit. Great. Let's make sure you find the right investment bankers, the right lawyers, get you introductions to those large companies who might acquire your company or provide distribution. So all along that journey, give you that support at the moment you need it to make your work just a little bit easier. And then at the end of it, you come out, you have this great expertise and experience. We're then going to ask you to pay it forward and to go and help the next entrepreneur share your knowledge when they're trying to build their first board of directors or raise that round. And in doing so, reinforce that culture of an inclusive startup environment that supports the community and sees accelerating growth.
I love that you guys can bring that end-to-end support, because I've heard in first-person connections with founders who have gotten to a fully flourished business that there is a want to help support other people who were in their shoes, because they want to just easily disseminate that information. Giving them a vehicle to do that and a way to easily connect with people who are looking for help and being able to direct it so that time is well spent is so valuable. That just seems like a massive need among all industries.
Yeah. I mean, that when we started, we thought investor connections was going to be the biggest request. The peer-to-peer connections have been the number one. So we call it the Ready Reserve, where we've gone out to our experienced entrepreneurs and we've said, hey, would you pre-volunteer? From time to time, we'll call you up. Another entrepreneur is going to have a question that only someone like you could really answer. Will you help? And we volunteered all of these entrepreneurs to do that, who now every month we're doing 50 to 75 peer-to-peer intros. That it's not mentorship. It's not a board role. It's, hey, I've got a question that only someone else who's done this could really answer, and they're answering the call and helping out.
Got it. No, that's absolutely wonderful. So speaking on that first leg you mentioned of capital, what type of investors does Medical Alley look for, or Medical Alley starts specifically, to connect with the startups that you guys find?
Yeah, we run the gamut. The majority of our work has focused on institutional investors, aka venture capital. That's partly because the nature of the industry we represent, a lot of its sectors are very capital intense. You know, we do a lot of digital health work where there are companies who do bootstrap their way to quite a large business. But if you're doing a medical device or a biotech company, unless you're independently incredibly wealthy, those just are not bootstrappable businesses. You know, you spend a decade with zero revenue. You need outside capital. So that's been our core focus. And those are VCs all over the world. I know there are a lot of organizations who are really focused on, like, how do we get more investors in Minnesota? We want those. But we're starting with the world as it is. And the world as it is most venture capitalists are in Silicon Valley, Boston, and New York. So we go to Silicon Valley, Boston, and New York, build relationships, and then send them deal flow.
And if you're working on networking and reaching out to different venture capitalists, what's the main elevator pitch or value proposition that you bring to them that they find in Medical Alley startups?
It's real easy. We asked them, would you like to see a higher volume of high quality deal flow from entrepreneurs who are building real actual businesses, solving real problems with fair valuations, low likelihood of fraud or abuse, and that have an entire ecosystem of success around them in building some of the biggest healthcare ventures on earth, right? Medtronic is the number one medical device company on earth. United Health Group is the number one health insurer on earth. Mayo Clinic is the number one hospital on earth, and they're all neighbors. And that they respond to very strongly. They can see more deals that are very high quality. Their capital goes further than spending it on a WeWork in San Francisco. And they know the companies here, they tend to be real, not a lot of hype, but a lot of delivery.
I love that. That definitely seems like a very clear value understanding for them as well. So, what kind of customer or marketing focus do you guys have, and do you try to provide to the teams? Is it mainly connections to different marketing bodies or agencies that they could work with, or is it techniques, education, or different types of resources like that that you try to provide to the companies?
Yeah, it really runs the gamut. So we do a lot of referrals where it is, hey, I need an agency, I need a fractional CMO, things like that, and we'll help them find it. On the more general supplier side, we do over 10,000 referrals every year, tracked in our CRM, where it's a company says, hey, I need help finding X, and we help them track it down. But then it's also a lot of strategic things where they might want to talk to a marketer from a health system or from another startup or a slightly larger company and get perspective. We have a lot of technical founders who they know their space really well, but they're not familiar with PR and with the way the news world works. So we spend a lot of time educating them on that and how they can use that effectively. And then sometimes, and actually quite often, it's using our own platform, our website, our podcast, our newsletter to share the stories of those companies because our readership are their customers or their potential acquirers or their potential investors.
Absolutely. And it seems clear in that light, too, why that shows so much value to venture capitalists all over the world. It's almost like having your own higher academic alumni network to help serve those startups you've found they're already in that same major. They know exactly what you're going through.
Right. And it's exactly it. Yeah, well said.
You shared recently on LinkedIn that Medical Alley is approaching 750 members. What does the membership base look like, and what type of businesses make up that 750?
The 750 members are a relatively diverse group. Device, digital health, diagnostic, and drug companies. And then the payers and the providers are kind of our core membership. And then a wide range of suppliers, manufacturing firms, marketing agencies, law firms, that whole ecosystem that goes around those companies. They range in size from the global giants, Mayo, Medtronic, United Health Group, 3M, to early stage pre-incorporation startups and everything in between. About half of our members are pre-revenue startups. 80% of them are under 3 million in revenue. And then the remainder are, from 3 million up to hundreds of billions of dollars in the case of United Health Group.
Sure. So when you were mentioning those 14,000 companies in Minnesota, it really could be any of them that are looking to get involved in this network that could qualify.
Indeed. Yeah, we're working with medical practice groups, small clinics. We're working with ambulance services, pharmacies. If it's healthcare, we want to serve it. We want to partner. And increasingly, we're also seeing companies that are not in Minnesota, around the country, around the world, where they have an interest in this ecosystem. The work we're doing, the work you're doing, the work groups of like Beta and others are doing is having an effect, and it's attracting interest from around the world. We recently welcomed Bayer, the pharmaceutical company. People know aspirin as a member from Germany because their digital health investment group in scouting the U.S. identified that this is one of the top markets in the world, but they didn't have anyone in it, and they needed to be present and starting to connect.
Wow. Well, that's very exciting, and an additional international connection I did not know about.
Right? Yeah.
On a personal note, I've got a cousin that's a permanent resident working over in Australia. So I was also excited to see that you guys have a fairly significant connection with the medical industry over in Australia, and that you kind of spearheaded part of that project.
Yeah, Australia has been our top international market for a number of years. They have a very advanced research community, and they do a lot in neurotechnologies and cardiac technologies, particularly in complex implantable devices. That's basically Minnesota. We are the king and the queen of complex implantable devices. So a lot of the community in Australia has really deep relationships with the community here. And so it was a very easy one to build up, where we worked with Australian companies that are looking to enter the US market, as well as help Minnesota companies find partners and research organizations in Australia, particularly in Melbourne, which is their largest kind of biomedical research hub.
Got it. So, anyone getting excited about all of those potential connections or how they might be able to help serve a business looking to grow in this ecosystem that wants to get involved, what might be the best avenue for them?
Yeah, the thing I always suggest to a company is ask yourself if the reason you want to get involved is about the mission or about the market. Both are right answers, but they have different ways of engaging. If you're a company or if you're a person who really cares about making sure there's a future for healthcare and health innovation in this ecosystem, then you probably should join as a member, get involved, support the cause, do your part to make sure this is around tomorrow. If you're a business that's really focused on the market and you see prospective customers that you want to tap into, then we should talk about some of our marketing and sponsorship tools that you can spend the same amount of money, but you're going to align your effort to the work you're trying to do, right? Both are right answers, but we're always, when I put my sales hat on, we're always wanting to make sure that if we're going to take your money, if we're going to spend your time, that we're doing so in a way that creates the value you care about. For some, it's mission, for some, it's market, and for some, it's a little bit of both. As long as we're clear about that, I'm confident we can do you right.
That is a very unique description I've not heard before, and I love that it gives avenues for both, because there are different focuses and different value that a person would get from both of those perspectives, so it does make sense to draw a line and differentiate between them. I've just not heard it before, so that's very cool.
We've learned it the hard way over the years, and just a small bit of inside baseball for anyone that's listening, because this is true of any association or network group or not-for-profit. We get companies all the time that they want to become a member, and they really are interested in selling to this audience, which is totally cool. This is a business group. Let's do business. But if you buy that membership, you're not really buying channel access or marketing, and you're not going to get the value you want. I kid you not, we have 50 plus companies a year who join after we tell them not to join as a member. We literally tell them not to give us their money unless they want to spend it on the marketing thing. And almost 100% of them, come renewal time, do not renew their membership. And so if there was a message I could get out, is just like putting my business hat on, think about it. Do you care about mission or market, and make your decision on that.
Absolutely. And what do you think the biggest mission value a company can contribute to Medical Alley is? It might be a list of a few, but what do you see sticking out as the biggest need from members now for Medical Alley to continue on?
Oh, yeah. I mean, it's two very simple and direct things. It's capital and connectivity, right? No money, no mission. We need to be capitalized in a way that we can keep investing in these critical efforts. And I feel very fortunate that we have grown healthily for many years now. Our members support us. More come in. We welcome more. The second is connectivity. No matter how many people I know, there are more people I don't know. No matter how much I know, there's more that I don't know.
Yeah.
We depend on the membership community to help us extend the reach, to tell the story, to support their fellow members. And if we do that, that's why we're so focused on culture change. The outcome will happen. Medical Alley's 20 staff, we're going to make an impact, but that impact will be far greater if 20 more people in the community step up and say, I will help my fellow innovator. I will contribute to the culture of this collaborative ecosystem.
It's very easy to see why something like that you get passionate about can loop you in for so long, going on 18 years, because it seems like an environment very conducive to finding others around you that are feeding into that energy.
We get paid to hang out with smart people who save lives. And if we do our work right, they'll save more lives. That's easy to get up in the morning to do. It's very motivating. And we are so lucky that there is this incredible community, the healthcare and the health technology community right here, that's what they get up every day to do. Like, there could not be a greater alignment of mission than what we have in this community today.
That's awesome to hear. So when you look at the companies and startups involved in Medical Alley, what areas of their business, to link it back to the tech nerdy podcast that we are, do you see them using technical products to help solve those problems? Maybe it's in mobile app developments or other more exciting fields like virtual reality, augmented reality, maybe Internet of Things, Bluetooth smart devices that are starting to connect all over.
Yeah, I mean, it's all of it. So the healthcare and the health technology industry in the state always has been high tech, and there's been different pieces used for a long time. IoT, we used to call it M2M, has been around for a long time. Virtual reality has been around for a long time. What's happening now is the connectivity of these different technologies. So particularly in medical device, for a long time you had data generating devices, but it was N of one. What's really powerful today is we're getting N of many. We're taking the data from millions of devices, crunching it together, analyzing it, and getting insights that allow us to make better treatment decisions than we could do with a traditional clinical study. Or it's with advanced computational methods that are allowing drug companies to conduct research in silico instead of in vivo, right? So I can simulate a drug in the body on a computer instead of putting that drug in an animal for a preclinical program or in a human for a clinical program, optimize it before I go into a human study, right? So I reduce risk of harm, I reduce risk of failure by simulating it in the computer.
So have they been able to prove the accuracy of those computations and simulations to the point that they are able to then use it to develop different research?
Exactly, right? Like, at some point, you have to go and do the human studies. But what you want to do is find ways to make them as small as possible while still statistically significant. Computational methods are increasingly allowing that because we can do better simulation up front, figure out what we need to do to optimize the product so that when we go into the human study, we have a better sense of what the risks are, what the safety profile is, and we put fewer people at risk to get to that outcome we desire. It's never riskless, but it is less risk than we had before.
Absolutely. And it's also interesting seeing that parallel between both data and people, where that kind of cohesive connectivity between different human resources and different data really allows you to accelerate things beyond anything linear.
Right. No, that's exactly it. Like the speed up in processing power, and then just the software engineering developments of the last 10 years have put tools in the hands of these small medical device and biotech companies that, 20 years ago would have been $100 million projects at only the largest organizations. The democratization of data and computational power has revolutionized every industry. We're seeing that in healthcare right now.
Absolutely. And Frank, wrapping up here, are there any final thoughts you have regarding Medical Alley or the startup space it provides that you would like to touch on before we finish up?
I would say to every entrepreneur, every investor, every corporate that's out there, if you're interested in this community, if you want things to be better, two really easy things you can do. One is reach out. We'd love to chat. We'd love to plug you in. The second is help one person or one company. Don't get hung up on trying to solve the problem. Just go and help that one entrepreneur who is asking for help. That is progress that makes the world a better place. And then tell a friend to do the same thing. And imagine if, all 14,000 companies in this community helped one other company, how big of an impact that could be.
That idea just made me smile, Frank. I love it. So if anyone is looking to reach out and learn more about becoming a member or investing in Medical Alley Starts, what's the best place to send them?
You can go to medicalalley.org, alley like you find behind your house. So medicalalley.org is our website. You can find me on LinkedIn. We're all easy to track down. Drop us a note. We'd love to chat.
Perfect, Frank. Thank you so much for the talk today.
Yeah, thank you. I really appreciate taking the time and doing the good work to share good stories.
Thanks to Frank for joining the podcast today. If you'd like to learn more about becoming a member of Medical Alley, visit medicalalley.org. Our team recently became a member of this great organization, and the procedure was painless. So if you're not already a member, we couldn't recommend it more. Show notes for this episode are at constantvariables.co. If you're looking to learn more about the host of the show or connect with anyone here on the Constant Variables team, you can reach out to us by sending an email to hello@constantvariables.co. You can also find us on Twitter and Instagram. Today's episode was produced by Jenny Karkowski and edited by the wacky Jordan Doust. This episode was brought to you by the Jed Mahonis Group. Check out the health and medtech digital tools and apps we've been behind the scenes of by visiting jmg.mn/medtech. You can find that link in this episode's show notes.